Hi, I'm Robert Edwards. I helped create the Integrative Medicine module on autism. I wanted to take some time today and talk about biomedical therapy in autism. There was not a lot of time spent on this subject in the module, so I thought this would be a nice supplemental piece of information primarily for clinical providers such as family medicine doctors, other primary care physicians, and any specialist or mid-level providers associated with the care of autistic children. A lot of this information is based on a recent conference I attended through the Autism Research Institute. I was at a conference in April of this year in Atlanta, and some more current data was presented at that time, and I thought this would be a great avenue of sharing that with you. First off, one thing that I hear a lot is what I think is causing the epidemic of autism. I think there is a lot of uncertainty there, but one possibility certainly are environmental toxins and the burden of environmental toxins on children and mothers and the public in general. One new paradigm that's been put forth is a triad of contributors, if you will. And one researcher, Jill James, and I'll share some of her research with you today, thinks of it this way. She thinks of it as an interaction between environment, the patient, and their epigenetics and genetic makeup, and maternal epigenetic and genetic makeup. So those three corners of a triangle interacting with each other, creating different levels of risk for autism. I think this is a reasonable way to view it in my mind. Another question that comes up is the possibility that autism may be reversible to some degree. And certainly hear of anecdotal stories regarding reversibility of certain characteristics of autism or completely losing the diagnosis through a variety of mechanisms, including intensive behavioral therapy and sometimes through biomedical treatment. I think there is certainly plausibility there. And one idea is the plasticity of the mind and the fact that some of the deficits we see in autism don't seem to be hardwired. A really interesting study that was presented recently looked at the effects of fever on autistic symptoms and the fact that some autistic children become verbal during febrile episodes, and the fact that once the fever breaks, their nonverbal baseline returns. And so that's been very difficult to explain, that phenomenon, other than there is this possibility of reversibility in the core symptoms. Very fascinating. So one question that comes up often is whether or not there's a high burden of toxicity or chemicals on us as human beings in the United States. In 2005, the Environmental Working Group set out to study that very question, and what they found when they tested 10 different umbilical cord blood samples was that there is indeed a high burden of chemicals found in the average fetus's bloodstream. We used to think that the placenta served as sort of a barrier between our environment and the fetus as it developed. This study actually put that question to rest as well, showing that indeed many of the toxins that moms are exposed to are actually being transmitted to the fetus even before birth. What they found was about 287 different chemicals in these umbilical cord blood samples. Of those, about 180 cause cancer in humans or animals, 217 are toxic to the brain and nervous system, 208 cause birth defects or abnormal development in animal testing, and nearly 200 have been banned from the market for years, yet they're still showing up as recently as 2005 in maternal and fetal bloodstreams. So the next question that will come up is, okay, these chemicals are there, but aren't they safe? You know, we've probably tested these as far as their safety and human exposure? And the answer to that question is no, we haven't. What we know is that about 2,863 chemicals have been tested for some level of toxicity. That's out of about 80,000 that we know have been released into our environment and that are used on a regular basis. Of those 3,000 chemicals, only about 21% have been tested for developmental toxicity. That leaves about 78% being untested. Furthermore, we have really no tests available to analyze on the interaction between the chemicals. And what statisticians tell us is that if we're testing the interaction of 3 different chemicals and we're looking at those 3,000 chemicals that have been tested, the number of tests to really analyze those interactions amount to about 85 billion tests. There's no way that's going to be done in the near future. So that leaves us as being the potential test tubes in this experiment. This next slide is a graphic of one of the most commonly referenced metabolic cycles in biomedical treatment of autism. This is the methionine transsulfuration to cysteine and glutathione cycle. It's also called the methylation cycle. The key components in here are folate, or folic acid on this side, SAM, here homocysteine, cysteine, and then GSH stands for glutathione. What we know is that glutathione is one of the most, if not the most potent antioxidant in the body. So the level of glutathione directly relates to our body's ability to detoxify. The other thing we know is that methylation is critically important in a number of metabolic events in the body, including genetic modifications. And so methylation you'll hear a lot in the field of epigenetics. So this is very important as well. If there's some compromise in the methylation system, this is a plausible way that could impact on our genetic function and protein synthesis from our DNA. I wanted to include this in the talk because, again, this is something that you'll see come up very frequently when we're discussing biomedical treatment for autism. So finally, I'm going to close this talk with some information on studies that are being performed looking at specific biochemical markers for children's ability to detoxify and using that as a plausible explanation why some children benefit from a biomedical treatment in regards to their core autistic behaviors. One specific researcher, Jill James, has done a lot of good research on this subject. She first released a study back in 2006 looking at the difference between typically developing children and autistic children and specific biochemical markers. The things she looked at are cysteine, glutathione, and glutathione to reduced glutathione ratio. And what it showed is that at baseline, autistic children had significantly decreased levels of these core biochemicals. If we look back at the previous slide, looking at the methionine transsulfuration cycle, you can see that these are the core biochemical markers that are found in this cycle. So one theory is that that is either the cause of some of the symptoms we see in autism, or the other possibility is that it's just a reflection of the autism itself and not necessarily causative. So to further study that, just this year she's publishing a study where they intervened and tried to increase the number of some of the core biochemicals and seeing if it would make a difference in a group of children in their core autistic behavior, and also looking at the numbers to see if those correlated. The intervention in the study was giving children methyl B12, that's through injection, at a dose of 75 micrograms per kilogram every 3 days. They also used folinic acid in the dose of 400 micrograms twice a day. The inclusion criteria was autistic disorder, ages 3 through 7. The children had to have never had other supplementation with these treatments, and their baseline glutathione level had to be below 6 to qualify. The endpoints were looking at methylation and glutathione metabolites and using a behavioral scale called the Vineland Adaptive Behavioral Scale to measure changes in behavior. This is a really common behavioral scale you'll see referenced in a lot of studies in regards to autism. So the results of that study showed that the difference between the pre-treatment levels and the post-treatment levels in some of these biochemicals did not change significantly, specifically methionine and SAM. However, some did change significantly, including cysteine, total glutathione, and the glutathione to reduced glutathione ratio. So that was fairly interesting. Furthermore, using the Vineland Adaptive Behavioral Scales, they found that there was significant change in behavior between their baseline scores and the post-treatment scores. Most strongly in communication, daily living skills, socialization, not so much in motor skills, and then also in the composite scores. Now, how do you interpret this? Really, the summary showed that although treatment with methyl B12 and folinic acid significantly improved core behaviors, they still didn't reach the standard scores for unaffected children, which is average of about 100 plus or minus 15. So the conclusions from that study and Dr. James are that improvement in the measures of both metabolic and behavioral endpoints converge to suggest that some children may benefit from targeted nutritional interventions, including supplementation with B12 and folinic acid, and that this provides some strong preliminary evidence to want to get a double-blinded, placebo-controlled clinical trial, as this was an open-label trial in this specific study. So, certainly no definitive answers, but some information that is worth sharing and worth thinking about. I think we did a pretty good job at reviewing the latest research on biomedical treatments and also integrative approaches towards the treatment of autism. And this is a little bit of supplemental information, the most up-to-date stuff I could find to share with you. And I hope you enjoy this information and make good use of the Autism Module on the Integrative Medicine website. Thank you very much.